Welcome to Real Vermont News. I'm Bob Frenier here to say somebody's finally looking into things. Today, we're looking into how to lower health care costs by paying a lot more attention to health savings accounts. Here's correspondent Rob Roper with details.
Thanks, Bob. Let's start by remembering that last year the teachers union killed Governor Scott's plan to switch their teachers and their families to a system with more basic insurance coverage, but practically no out-of-pocket expense for them because the plan included a fully funded health savings account to pay for any service not covered by the basic plan.
And if the teachers didn't use all that money in their health savings account each year, they could have kept it. Do you think that would have encouraged the teachers to shop around for their MRIs or try out the local urgent care facility, or maybe even wait a few days to see if that ache went away on its own?
Of course it would, and reduced demand by smart shoppers always lowers prices. Unfortunately, the teachers union's claims that health savings account incentivize people to ignore symptoms until it's too late, ultimately costing more, but there's no proof of that. And the current Green Mountain Care Board already restricts hospital budgets, so people's access to care is already limited by bureaucrats.
Any diminished demand on the system would be easy to track too, because all those teachers and their families, about 35,000 people, would go from having no skin in the game to having a clear financial incentive to self-regulate their healthcare system demands.
And after a few years of demonstrating how health savings accounts can reduce demand, Vermont could ask the federal government for permission to implement a similar system with Vermont's Medicaid population. That's nearly 175,000 people with almost no financial incentive to self-regulate their demand for health care services. The savings from giving so many people such a health savings account incentive could be enormous.
So let's be clear. It is the teachers union and only the teachers union that is opposed to a statewide health insurance plan for their membership using health savings accounts to reduce demand. The teachers' health care issue is coming up again this year, and Vermonters need to tell their representatives to stop kowtowing to the teachers union and strike out on a new path of health care reform that will help reduce prices by lowering demand. To make this happen, like this video, click your Facebook share icon to share this story with all your friends. Then contact your state representatives and senators on contactyourrep.net to tell them you expect some action on a statewide teachers' health care contract that will demonstrate the power of health savings accounts to lower health care costs. And that's all the Real Vermont news we have time for. A lot more happened, and we'll be looking into all of it.